back now with another kind of band, which is a second order band. What is a second order band? So they are bands that are made in the vertical direction of the arch wires. As you can see, when you do the vertical bands, we want to do like angulation or tip, or we do intrusion or extrusion. So those are the bands that we use a lot in our orthodontic cases. We do that too much when you do, for example, a simple extrusion or slow extrusion or orthodontic extraction. So those are the cases where we use a lot this kind of bands. And when we want to do the correction of the tip, so these are situations very common in our practice, and we are doing this kind of band in order to correct or in order to do the whole treatment. Sometimes we just want to do this extrusion, the slow extrusion, for example. Sometimes our patients are referred to us just to do this kind of specific movement. So if we know how to deal with this kind of band, those extrusions, those little slow extrusions, we can do a whole treatment just based on the knowledge of this kind of band. So this is the second order bands, okay? We're going to say much about the intrusion extrusion later, but now we're focusing on the angulation, on the tip of the tooth or a group of teeth, okay? So in these cases, when we want to do the second order band in order to correct the angulation, we are doing almost the same thing as we do when we do the rotation, the derotation of the tooth, as we've seen before. So in these cases, it's almost the same thinking. And now I'm going to show you step by step how to do this before you do the training on your videos, on the videos that you're going to receive, to do the training and your exercise book to do the same thing here. So first of all, in what direction do you want to tip your teeth? So if you want to distalize the root, for example, let's say an upper central incisor, and they want to angulate it, you want to tip it, going with the root distally and the crown medially, okay? So how do you do that? What kind of band do you have to use in order to achieve this kind of movement? So this is a second order band, a second order Z band. So this is the way we do it. The aim here is to initially construct or to make a band upwards. This band will form an angle of approximately 20 degrees in relation to the arch wire plane. So first up. So my first thinking here is to do this bending in order to do the correction of the root. Okay. So if I want to go distally with the root, if in the upper arch, for example, I'm going to do this kind of movement. Are you with me? Look at my hand. So I'm doing this. For example, this is the midline, central midline, and I'm going to do this kind of bend. To go distally with the root and medially with the crown. So this is how we think the second order Z bend. So when I want to do this movement, distalizing the root, I'm going first upwards in the first band. So I grab my plier, I grab the wire with the plier, and then I squeeze the plier in order to have a steady movement, okay? So now I'm going to do this first movement upwards. So this is how we do. First upwards. We can do both, just doing the pressure or just rotating our wrist in order to have the same kind of movement. In this case, I'm giving you here this other example of doing the same bend. So in this case, I can put my index finger on the medial portion of the arch. So grabbing the arch wire with the plier, I grab the arch wire here. This is my plier, and I'm putting the force in this position, medial to the plier. So I can do either the movement like this, with pressure in my index finger, or grabbing here, I just stop my index finger, and it's part of the movement when I do this kind of rotation of my wrist. Can you understand this? So I'm doing like this. So this is another way to do the same bend. The aim here is to initially construct this upward bend. So I'm doing this in another fashion, which is just rotating my wrist and using my finger just as a support. So I'm doing the rotation of my rib. This is going to do all the movement. Here is another way to do. As I told you, the first way I've taught you was just doing the pressure and staying with the plier almost without any movement. So this is the first, and now I'm doing this. So this is how I do. First upwards, the second bend without removing the plier from its position, from its initial position. Continuing to hold it firmly, steadily, is made by pressing downwards. Remember that the direction must be perpendicular to the plane of the arch. With the thumb or index finger, I do this kind of pressure. Why am I calling your attention for this point here? Remember that the direction must be perpendicular to the plane of the arch. Because if you just doing this kind of movement, if the wire rotates, you're going to produce another kind of bend, not a second order bend, probably something between the first and second order bend, or meaning with an angulation out of the vertical position. So firm, you have to grab the arch wire and you squeeze your plier in order to secure the arch wire for it does not rotate, okay? So grab it here and do the pressure. First upwards, second downwards. So first upwards in the mesial part of the arch wire, and the second you go distal without removing the plier from its original position. You now do the pressure in the opposite direction, meaning downward, okay? So this is what you're going to produce, and this is the angulation or the angle you want to produce here. Something like 20 degrees related to the horizontal plane of the arch wire, okay? So the other two bands are the same as the first bands you produce in the mesial, okay? So now we have upwards. Again, you can put your finger here and do just the wrist rotating, so like this, or you just secure your arch wire, you grab your arch wire with the plier and you do both, rotating your wrist and pressing your finger upwards. So this is something for helping you to do less force to do the bend. So now we're going back, and then we do the second bend, removing my fingers from the mesial, putting it distally to the plier and pressing down. This is the last bend that I'm going to do now. So let's read it here. The next two bends are equal to the first ones. Initially, it is bend upward, the distal portion of the arch wire here, okay, as you can see, which can be done either exerting a pressure on the wire distally to the plier, or as exemplified here, like I said, like I told you before, this is the second way, a second fashion of doing the same thing, okay? Grabbing here, so the finger is here just to support the force of the arch wire that goes down. It prevents it goes down, so it's going just exert a pressure against the rotation of your wrist, okay? We're having the opportunity to say that again when you go to the videos with the step-by-step movements, and you're going to do the exercise on your exercise book, okay? So this is how we do, producing this angulation, which is going to tip the tooth. The finalization of the bend. Push the distal section of the wire downwards, okay? So this is the final configuration of the bend, the Z bend, the second order Z bend, and you have to do this now. You have to be sure that your movement didn't change the height of the anterior or mesial and distal portion of your arch wire. So now you have this kind of bend, this angulation in the middle. This is actually the active part of the bend, which is going to go inside the slot, and you have the mesial and the distal portion of the arch wire which has to be completely linear, completely in the same line here, as you can see. When you look from above, you put your arch wire in a position and you look from above, you have to see this. You don't have, nothing is outside of the line of the arch wire. So this is a second order Z-band. So you can see here, this is the wire going straight here without disturbing the line of the arch wire. So it is imperative to check the arch wire shape in both occlusal, this is the first bill, occlusal, and lateral direction. The arch wire must remain with its outline, not deviating from the line drawn from the parabolic arch. So this is something very, very important. We have to produce the right band, and to check, in order to check it, we go looking like this, lateral view, and an occlusal view, meaning you put your arch wire in a surface and you look from above, so you don't see any disturbance here of the line of the arch wire. So it remains like a line, as it says. So when you see laterally, when you see in a lateral view, you have to see this line continuing here and just having up and down related to the line, those 2 points. This is the second order Z band, and you use it a lot. As I told you before, I start doing this kind of band when I think that I have to do in order to correct something. For example, lateral incisors, upper lateral incisors are really tricky to do the position, to do the right position, the correct positioning of the bone of the bracket during bonding. During the first phase of treatment, the bonding of those brackets. Sometimes we miss, sometimes we misplace these brackets, and we sometimes commit some mistakes like doing a little bit of twist of these brackets, and we don't have the correction of the roots. So this is very, very, very useful for us in our day-to-day practice. Since I see the mistake, when I see the mistake, like for example, when I have the Penorex evaluation, I always do that like 3 or 4 months after beginning the treatment, after starting the treatment, after starting aligning teeth. So I do a panoramic X-ray, and I check the angulations. I'm usually, if I have a slight moderate crowding, for example, or a mild crowding, and like 2, 3 or 4 months after initiating the treatment, I am probably in something like the 016, 018 arch wire. So if I see this problem, if I see that I committed some mistakes with the angulation, with the tip of those teeth, what I do is I start correcting now, because the next arch wire, the next wire I'm going to put inside the slot, it goes with another Z-band greater than this one, or the same size if I have correct already, or I can intensify the band in order to continue the correction. So it depends on what I find when I look for the case. So what I do is I'm going to check the angulation in this panoramic X-ray, in this phase of the treatment. I do the panoramic X-ray in order to see if everything is okay. If it's not okay, if I have to do some angulation, I do it now. I do it with this second order Z-band. What is the option for that? We can do rebonding now. We can rebond our bracket, but we have to go back. We have to go backwards in our sequence of arch wires. In this case, I'm going forward. I don't stop changing wires. I don't stop putting thicker wires in my sequence. And when I get this correct, I do the rebonding, and I do the positioning of the bracket now completely passive in relation to the arch wire. So this is how I do, and I think this is faster for my treatment, okay? So we stop here, just understanding the second order Z-band, and we come back with more information about this same band. This is a very beautiful band, and I do it a lot. We'll see some examples where clinically it helped me a lot with some cases, okay? So see you later. Bye-bye.